As we near Halloween, I thought it'd be appropriate to talk with you about one of the scarier aspects of healthcare, your bill. Hi, I'm Professor Sean, and welcome to Healthcare 101. In this episode, we're going to be talking about the dreaded medical bill and all those other letters you receive in follow-up all the way to collections and more. Stay tuned. As discussed a few weeks ago, over 51% of the U.S. population is in medical debt between $50,000 and $10,000. I also mentioned how healthcare plans are beginning to increase how much you, the consumer, will have to pay to access services. Again, these additional costs are to help offset some of the expenses the insurance companies have, but also it's to provide a little bit of a disincentive for you to get the care you're looking for. How many of you have been shopping for a product? Let's say you're at a Best Buy or something, and before putting it in your cart, you make a quick price comparison on your phone. You look at Amazon, you look at other online retailers. If you're at all like me, I do it quite a bit. As a consumer, I go through a lot of mental gymnastics before I decide whether or not I want to buy the thing today or whether it is okay for me to wait a few days to get a better price. We do this all the time. So imagine if healthcare were the same. I know that all of you are aware that healthcare does not lend itself to the same shopping transparency. How many of you know how much your provider charges you for an annual physical? It certainly isn't posted on the menu above the registration desk, nor can we quickly check the prices online. In a minute, we're going to break down a medical bill in an effort to help you better understand the pricing gymnastics that healthcare billing goes through. But before we do that, I thought I'd provide a brief overview on the current state of what we call healthcare transparency. In 2021, the federal government rolled out a hospital transparency rule, which required hospitals to publish their standard charges for all services and to make the prices of the 300 most common services accessible in a consumer-friendly format. I decided to look for these published documents from a few of the better-known healthcare organizations. Two examples that I have is Stanford Health Systems publishes their fee schedule, and it's a 196 megabyte downloadable CSV file. That's a file that can be opened up using most spreadsheet applications like Microsoft Excel. I also looked at the Mayo Clinic's fee schedule, and that was available as a 1.46 gigabyte JavaScript file, which I gave up on working how to open, but it did take a good 15 minutes for it to download. So that is where we are currently with price transparency, and don't get me wrong, what both those organizations did is genuinely complying with the federal rule. However, I don't think it was the rule's intent. The goal of the rule was to begin to push healthcare providers to open up the mystique behind their billing practices. As of January 1st, 2022, only 14% of all hospitals in the United States complied with this rule. California regulators took matters a little bit further when they required all hospitals to fill out a very specific spreadsheet where these hospitals were required to put in their fee schedule charges for some of the more common services. Now, a fee schedule is the way with which a hospital sets their base prices, and they do this quite often before getting into contracting rates, but more on that in a bit. Let's get back to California and price transparency. When researching California hospitals, I went ahead and I looked at some of the more memorable names. You can see the list of those here on my right. Now, what you're going to see next is two different price comparisons, which I think really call out the wide variety of pricing across different California organizations for the exact same service. Just note that the prices you see are not in any order when you're looking at the list of hospitals. So the first one I wanted to talk about is what's known as a complete blood count. So CPT 85025. And if you really want to know, a CPT is nothing more than, think of it as the catalog number by which all healthcare organizations can charge for that CBC. So each one of the hospitals has their own price for it, and you can see that of the hospitals I researched, those prices for that single test range from $166 all the way up to $1,190. Better yet, I decided to look at something that may be a little bit more understandable, such as an emergency room visit. So the charges you'll see here, these are for what's known as a CPT 99283, which is an emergency room visit level 3. So the levels go from 1 to 5, with 5 being the more serious. Those prices across all those same hospitals range from $1,000 all the way up to $7,337. So when you begin to think about how healthcare transparency really works and what the prices are, you're going to need to know a little bit more about how are those prices actually being used. Just to be clear, virtually no one will ever pay the rates that you see here. Those fees are designed in a manner that helps organizations better negotiate annual contract rates with insurance companies. Weirdly, they're similar to what we see on a car lot when looking at the manufacturer's suggested retail price, or MSRP. Historically, all of us know that the auto MSRP is the start of the negotiation, not the end. That being said, why don't we go ahead and take a look at the dreaded medical bill itself. For this exercise, I wanted to use an actual bill. Due to some close connections, I was able to get my hands on a good example of just how confusing a simple medical bill can be. For that, I'd like to introduce my mom. Mom, as you know, that I've been recording these videos for consumers, and I decided to use one of your bills from a visit to go see your eye doctor when they stick needles in your eyes. And I just want your permission that I can actually show, even though I'll hide your personal information, I want to make certain you're okay with me using your record just to show people.
I'm fine with that.
You're fine with it. And are you fine with more needles in your eyes?
Not so much. It's better than being blind.
Yes. Thank you. Thanks, Mom. So let's take a minute to look at her bill in some detail. This is a statement my mom received, which you can see it has multiple dates of service where she received a wide variety of different things. The top one we're going to look at is one where she had a visit to receive an eye injection from a provider, as well as some tests that were being done that day. This gets broken down into 3 different sections. The first section are what we'd call the charges. This is where the healthcare provider actually lists out each item that was performed and the fee schedule price. Remember, the fee schedule price is that amount of money of what the provider posts they're going to be paid, knowing that there's going to be a contracted rate that is different. So let's go to the next section, which is what did the actual insurance companies pay? In this case, you can see that the insurance payments from Medicare as well as TRICARE covered $1,898 of the charges. That's only 31% of the total that was billed. So what happens with the other 69% of those charges? Well, because there's a contracted rate with Medicare and with these insurance companies, that the healthcare provider adjusts these or writes them off. So you can see here that 69% of the total charges are removed from the bill entirely. This is what makes things a little bit confusing on the healthcare insurance end and on the healthcare consumer end. What we're actually being billed versus what the insurance companies are going to pay versus what really is the provider expecting to write off are all vastly different. Now, I realize that that was a very simple example for a very complicated problem. And I'm certain that some of you have examples of medical bills that defy explanation. And I'd love nothing more than to hear about those. So please do subscribe to the channel and add in your comments below, and I would love to take a look at your examples that you have. That said, the way with which a healthcare bill is put together is composed in a very complicated and bureaucratic fashion that doesn't really lend itself currently to much transparency. Therefore, I wanted to leave you with a few tips about how to handle your medical bills. First, never pay a bill you don't fully understand. If you have any questions at all, contact your provider, contact your insurance company, or look for a local advocate of healthcare. Number 2, you can always contact the provider to make arrangements if you can't pay your bill in full. You're going to be surprised just how flexible healthcare providers are in regard to your medical debt. And then finally, and most importantly, always get the care you need. I know that the financial aspect of healthcare can be frightening, but delaying care can lead to even more frightening outcomes. Thanks for watching. I hope you enjoyed today's episode. If you have examples of a healthcare bill that defies explanation or provides a really good example, I'd love nothing more than to work with you on it. So please feel free to let me know in the comments and I'll be in touch. Otherwise, until next time, stay healthy and stay informed.